Like one simple one is, again, because I thought you just put in more effort and you get something as a result. So if you see somebody walking around that doesn't look like they maybe are putting in the effort, now I think to myself, maybe they just don't have the means and the awareness, and maybe they were dealing with something that they're dealing with something that I was dealing with, where you're like, I'm trying harder than you could even imagine. And so it's like giving me more sensitivity for people to, respect where they're at and just know that the body is a beautiful, magnificent, complex thing.
I agree. And I feel like that kind of sentiment about working harder and being more restrictive kind of goes back to our youth when we could kind of get away with everything when
Yeah.
we were younger. And then when we try to implement that as we're older, I'm 55 now, none of that's not happening. So, like, I am certainly, and I guide our patients, like, you have to be more intentional about what you're doing, from a body standpoint. And for my listeners, predominantly female listeners, like, I want you to avoid frailty. So, you have to avoid osteoporosis, osteopenia. You have to lift weights. You have to do things that preserve your muscle mass and help your bones, because that is the thing, for mortality we want, to avoid. So I'm glad, obviously, I knew you lifted weights from our other conversations, but I think that's what I want